Here in Scarborough, the perfect example of a workplace that has felt the impact of COVID-19 when an outbreak was declared here at J&J Trailers last month. A small manufacturing business that was hit hard and can make the case for why employees and essential workers should be next in line for vaccines.
We had in one day only 5 people here. It was vacant. You look at a parking lot, you could not find someone.
Less than 40 employees and more than half ended up being hit by COVID. That's been the reality for J&J trailer manufacturers over the last month. One employee tested positive at the beginning of March, and it spread quickly. Now the owner says it wouldn't happen if those working in facilities like his had access to vaccines.
It's a very good idea. I think it's if they can come and do the vaccination here and on site. First, it's to relieve the health system and the hospitals and pharmacies, whoever doing it. Second, it's just we need it.
According to Toronto Public Health, there are 40 active workplace and community outbreaks in the city as of last Thursday, leading to more than 350 cases. Major companies like Mondelez and Amazon, each with multiple locations in the GTA, to Athletic Knit, a sports apparel manufacturer in Etobicoke. Despite going above and beyond safety protocols over the last year, a representative has told CityNews that it's led to most of the facility being shut down and more than half of the employees at home.
All the fact sheets are available online.
Toronto's mayor says it may be time to rethink the way vaccines are being doled out across the city, although there's no evidence the priorities have shifted.
It involves going out wherever we can to workplaces that are at higher risk and vaccinating on the spot, so that then it's much easier for people to get vaccinated in a place where they're much more likely to contract the virus.
In your opinion, are we on the right track? Does more need to be done? Where are you sitting right now?
Well, I think definitely more needs to be done. I mean, I think the data show so far that if you look at the areas based on their risk, so I think we need to up our game and get it to these high risk areas to these people, and hope, we need to make it more acceptable and more accessible for them.
While some medical experts believe the shift from Ontario's older population to essential workers would help tackle the third wave and rising number of hospitalizations, logistics will play a part.
It does take a bit of work, right? You need the people who are giving the vaccines to be speaking to these business owners and the employees, and making sure people actually want to get it. And we have to make it so that it doesn't feel like coercive.
At least one place that would have jumped at the chance if it was offered earlier, J&J Trailers. Thankfully, at this point, everyone is on the mend and back at work.
I am myself a COVID survivor. I got a COVID and cleared. And I'm lucky that almost everybody here got it and walked away from it. We have only one guy, he just took an extra couple of weeks.
So good news, at least here at J&J Trailers. Note that the city only publicizes workplace outbreaks at workplaces with 20 or more employees. So there's many more outbreaks throughout the city. Overall, the most common workplace for outbreaks in Toronto have been offices, warehouses, and construction areas.